Look at this. Right here in this video, you're watching an elder, someone who carries generations of ancestral knowledge, someone whose people survived ice ages, droughts, and centuries of hardship using nothing but what the earth provided. And he's rubbing a $2 tube of Colgate on the soles of his feet. Why? That's the question that started this whole investigation. Because this man didn't go to a pharmacy looking for a solution. He didn't watch a commercial. He didn't scroll through social media. He looked at that tube of toothpaste and recognized something. Something his grandmother had described to him in a language that most of the world no longer speaks. And what he recognized changed the way I look at everything sitting in my bathroom cabinet. Here's what you need to understand before we go any further. This is not a story about toothpaste. This is not a story about feet. This is a story about 3 specific chemical compounds that a billion-dollar industry accidentally, or maybe not so accidentally, put inside a product you've been using every single morning of your adult life. 3 compounds that native healers were using on warriors' feet 500 years before the first tube of toothpaste was ever manufactured. When I first heard that, I thought it was folklore. I thought it was the kind of thing people say to make old remedies sound more interesting than they are. Then I looked at the actual chemistry, and I had to sit down. Stay with me for the next 20 minutes, because what I'm about to show you is going to completely reframe how you think about foot health, fungal infections, and the $40 antifungal creams that your doctor keeps prescribing, the ones that work for 2 weeks and then stop. We're going to go deep. We're going to connect ancient plant knowledge to modern pharmacology, and by the end of this, you're going to have a complete 3-step protocol you can start tonight using things you already own. Let's get into it. The modern science first. Let's open up a standard toothpaste, a herbal one, a baking soda formula, or even just a classic mint variety, and look at what's actually in it. Not the marketing words on the front, the actual ingredients list on the back. You'll find a few things that most people skip right past. Menthol. This isn't just a flavoring. Menthol is a natural compound derived from peppermint oil, and it has demonstrated antifungal properties that have been studied in clinical settings. It disrupts the membrane of fungal cells, essentially punching holes in the outer wall that the fungus needs to survive and replicate. When you apply it to a thick yellowed toenail, menthol begins penetrating the keratin structure and reaching the fungal colony living underneath. Eucalyptol. Found in many herbal and natural toothpastes, eucalyptol is the primary active compound in eucalyptus oil. It's a powerful antiseptic. Studies published in peer-reviewed journals have shown it inhibits the growth of Candida albicans and Trichophyton species, the exact organisms responsible for most toenail fungal infections. Your toothpaste has been sitting on this compound the entire time. Sodium bicarbonate, baking soda. This is the ingredient that connects everything, and it's the one that stopped me cold when I made the connection. Baking soda creates an alkaline environment on the surface of the skin. And here's the key. Fungi are pH-sensitive organisms. They thrive in slightly acidic, warm, moist environments. When you change that pH, when you make the environment less hospitable, fungal growth slows and in some cases stops entirely. Now here's where it gets remarkable. The ancestral connection Native American peoples, particularly those of the Cherokee, Lakota, and various northeastern woodland nations, developed sophisticated foot care protocols out of absolute necessity. Think about the reality of their lives. Warriors and hunters would walk for days, through swamp water, through mud, through streams. Their feet were constantly wet, constantly under pressure, constantly exposed to the exact conditions that breed fungal infection, trench foot, and soft tissue breakdown. A warrior with rotting feet was a warrior who couldn't hunt, couldn't fight, couldn't protect his family. Foot health wasn't a cosmetic concern, it was a survival issue, and so healers developed solutions. Wild mint, not the cultivated spearmint you find in grocery stores, but the aggressive, spreading wild mint that grows along creek beds and forest edges, was crushed between stones and applied directly to the soles of the feet and between the toes. The active compound in wild mint, menthol, identical to what's in your toothpaste. Willow bark was used as an antiseptic wash for wounds and skin infections. Its active compounds include salicylates, the same family of chemicals as aspirin, which have anti-inflammatory and antimicrobial properties. And then there was something that sounds almost too simple: fire ash. The fine white ash left behind after a wood fire was mixed with water to create a paste, slightly gritty, highly alkaline. It was used to scrub the feet, between the toes, and around the nails. alkaline ash mixed with mint oil and willow bark, rubbed into the feet of people who walked through mud all day. You're looking at the original toothpaste, you just didn't know it. The compounds are different in name. They are functionally, chemically, almost identical in mechanism. This isn't spiritual. This isn't mystical. This is 500 years of empirical observation, of trial and error, of healers watching what worked and passing it forward, generation to generation. The elder in this video didn't reach for a tube of Colgate because he was impressed by advertising. He reached for it because he looked at the ingredients and thought, this is what my grandmother described. Now let's make this practical, because information without application is just trivia. This 3-step protocol is specifically designed for people dealing with thickened, yellowed or brittle toenails, chronic fungal infections that keep returning foot odor that doesn't respond to regular washing, diabetic foot care and circulation-related skin issues, general foot health maintenance. You don't need to have a severe infection to benefit from this. Many people who try this protocol are simply tired of dry, cracked heels and nails that look like they've been through something terrible. Do all 3 steps in order every night for 14 days. That's the minimum time required for the visible part of a nail to show genuine change. Nail cells grow slowly. This is a process, not a miracle. Step 1. The shock cleanse. Toothpaste and a brush. Minutes 1 through 4. You're going to need a tube of toothpaste. Herbal is best. Baking soda formulas are excellent. Standard mint works too. And an old toothbrush you no longer use for your teeth, or a stiff nail brush. Wet your feet in warm water first, just 30 seconds under the tap or a quick soak in a bowl. You want the keratin, the protein that makes up your nails, and the outer layer of your skin, slightly softened. Dry skin and nails resist penetration. Warm damp keratin is more permeable. Apply a pea-sized amount of toothpaste to the brush. Now scrub, not gently, firmly. Work the brush across the surface of each nail and then use the edge of the bristles to push carefully along the nail edges and into the groove where the nail meets the skin. That groove is where fungal colonies establish themselves. That's where the infection lives. Scrub for a full 3 minutes. Time it if you need to. Most people dramatically underestimate how short 3 minutes feels when you're doing something and how long it feels when you're counting. What's happening chemically? The mechanical action of the brush is lifting the top layer of dead keratin and debris. The menthol and eucalyptal in the toothpaste begin penetrating the newly exposed nail surface. The bicarbonate starts shifting the pH at the nail bed. You're not treating the nail. You're creating the conditions in which treatment can reach the infection. This is precisely what the ash and mint scrub accomplished for those warriors. The ash was abrasive. It physically stripped away the dead outer layer. The mint oils penetrated. The alkalinity disrupted fungal growth. Leave the toothpaste on while you prepare step 2. Don't rinse it off. Step 2. The forbidden soak, the Listerine protocol. Minutes 4 through 24. This is where the protocol escalates. You're going to need a basin or bowl large enough for both feet, blue or original gold Listerine mouthwash, white vinegar, warm water, and optionally a tablespoon of baking soda. The ratios: 1 cup of Listerine, 1 cup of white vinegar, 2 cups of warm water. If you're adding baking soda, add it to the water before you pour in the vinegar. Combining baking soda and vinegar directly creates a rapid fizzing reaction that burns through the active compounds before your feet can absorb them. Submerge your feet completely. The toothpaste from step 1 is still on your nails. Let the soak dissolve it slowly into the solution. Soak for a minimum of 20 minutes. Set a timer. Put on a podcast. This is not the step to rush. Now let me explain what's happening in that basin, because this is where people sometimes think this sounds too simple to work. Listerine was not invented as a mouthwash. It was originally developed in the late 19th century as a surgical antiseptic, something strong enough to use in operating rooms. It contains 4 essential oils: thymol from thyme, eucalyptol from eucalyptus, methyl salicylate from wintergreen, and menthol from mint. These 4 compounds together have demonstrated antifungal, antibacterial, and anti-inflammatory properties across multiple independent studies. Thymol in particular is remarkable. It's been shown to inhibit fungal cell wall synthesis. It interferes with the process fungi use to build and maintain their cellular structure. Without an intact cell wall, the fungal organism cannot survive. White vinegar contains acetic acid, typically around 5% concentration. Acetic acid is the pH modifier in this protocol. When you add vinegar to the soak, you're creating a mildly acidic environment across the entire surface of your foot. This is not the alkaline environment of the ash scrub. This is a different strategy. You're shifting pH in the opposite direction from step 1, and there's a reason for that. Fungal organisms are remarkably adaptable, but there's a range of pH that supports their survival. What you're doing across the 2 steps of this protocol is creating what researchers call a pH whipsaw. You hit the infection with alkalinity first, then follow with acidity. The rapid environmental shift stresses the fungal colony and prevents the adaptation response that lets infections become resistant to treatment. After 20 minutes, you should notice something visual. The skin around your toenails may appear slightly bluish or greenish from the Listerine pigment. Don't be alarmed. This is normal, it washes off easily, and in some cases it actually helps you see the margins of infected tissue more clearly. Remove your feet from the soak. Pat them dry with a clean towel. Don't rub, pat. You've created a clean, slightly open skin environment. Rubbing can cause microabrasions. Step 3. The nighttime sealing oil. The real gold. Minutes 24 through 30. This is the step that most people skip. It's also the step that determines whether this protocol works for 2 weeks or for life. You're going to need either pure tea tree oil, Melaleuca alternifolia essential oil, or homemade garlic oil. More on how to make the garlic oil in a moment. Apply 2 to 3 drops to each infected nail. Use a cotton swab or your fingertip. Work it in gently, pressing down on the nail to help the oil absorb rather than sit on the surface. Wrap a thin layer of clean gauze or a breathable bandage around your toes if you're concerned about staining your sheets. Put on clean cotton socks before bed. And that's it. Go to sleep. The morning routine. Rinse your feet with cool water. No soap on the nails. The compounds are still working overnight. Soap would strip them. Why tea tree oil? Melaleuca alternifolia, the Australian tea tree, contains terpenin 4-ol, which has been the subject of significant clinical research for its antifungal properties. A study published in the Journal of Family Practice found that tea tree oil was comparable to clotrimazole, a common prescription antifungal, in treating toenail fungus when applied consistently over 6 months. The advantage? No liver metabolism required, no systemic side effects, no prescription needed. This is the connection to the healing tradition that makes this step feel different from the others. Tea tree oil wasn't available to Native American healers. It's native to Australia. But the functional equivalent was cedar oil, pine resin, juniper berry oil. These were the sealing agents used in North American traditional medicine, applied to wounds, to skin infections, to damaged nails after the cleansing process. The principle is identical. After you've cleaned and disrupted the infection, seal the nail bed with a compound that continues working through the night. Create an inhospitable environment, not just once, but continuously. Don't let the fungal colony recover between treatments. The garlic oil alternative. If you don't have tea tree oil and you want an option from your kitchen, here's how to make it. Crush 3 cloves of fresh garlic and let them sit for 15 minutes after crushing. This allows allicin, the primary antimicrobial compound, to form fully. Then place the crushed garlic in 2 tablespoons of olive oil and heat on very low temperature for 20 minutes. Do not boil. Strain out the garlic solids and let the oil cool. Store in a small glass jar. Apply exactly as you would tea tree oil. Allicin has demonstrated antifungal activity against Trichophyton rubrum, one of the most common causes of toenail fungus, in peer-reviewed research. Traditional healers across multiple indigenous cultures used garlic and related allium plants as antimicrobials. This isn't folk wisdom dressed up as science. It's folk wisdom that turned out to be science. What the industry doesn't want you to calculate. Let's do some quick math. A prescription antifungal nail lacquer, the kind your dermatologist prescribes for moderate toenail fungus, costs between $400 and $700 for a single treatment course without insurance. With insurance, your copay might bring that down to $50 or $80. The treatment period is typically 48 weeks, nearly a full year of daily application. Clinical cure rates for prescription topical antifungals hover around 35 to 40%, meaning that for roughly 6 in 10 patients, the treatment doesn't fully resolve the infection. Many experience recurrence within 2 years, even when it does work initially. Now look at what you're using in this protocol. Listerine, Available at any drugstore, roughly $5 for a large bottle. You use 1 cup per treatment, so a large bottle covers approximately 4 treatments. White vinegar, $2 to $3 for a large jug, 1 cup per treatment. Toothpaste, you already own it. Tea tree oil, approximately $8 to $12 for a small bottle that will last months of nightly application. Total investment for a complete 14-day protocol, under $15. Total investment for 3 months of consistent treatment, still under $30. I am not a doctor. I am not telling you to throw away prescriptions or ignore medical advice. People with diabetes, with compromised circulation, with severe infections that have reached the nail matrix, those people need professional guidance, and this protocol does not replace that. What I'm telling you is that the pharmacological mechanisms in this protocol are real. They are documented. They are not magic and they are not folklore. They are chemistry that your grandmother's grandmother understood through a different vocabulary than we use today. The question you have to sit with is this: why is the gap so large between what costs $700 and what costs $15 when the underlying chemistry overlaps significantly? That's not a question I can answer for you, but it's a question worth asking. Let me be direct about the audience for this protocol, because I don't want anyone to misapply it. If you have diabetic neuropathy, reduced sensation in your feet, please do not use very hot water in the soak. You may not be able to accurately gauge temperature and can burn yourself without feeling it. Use lukewarm water and test it with your elbow or wrist before submerging your feet. If you have open wounds, fissures, or bleeding skin on your feet, skip step 2 until those have healed. Acetic acid in an open wound is not comfortable, and Listerine's alcohol content can delay healing in damaged tissue. If you are pregnant or nursing, consult a healthcare provider before using essential oils, including tea tree oil, in a concentrated application protocol. For everyone else, people dealing with stubborn yellow nails, persistent foot odor, chronic mild athlete's foot, dry, cracked heels, or just feet that have been neglected for a few years of desk jobs and closed shoes, this protocol is safe, evidence-adjacent, and deeply rooted in a healing tradition that understood the chemistry before the chemistry had names. The 14-day schedule. Here's exactly what you do and when. Days 1 through 7. Complete all 3 steps every evening, ideally within 1 hour of going to sleep. Consistency matters more than perfect technique. If you miss a night, don't restart the count. Just continue. Days 8 through 14. You should begin to see changes. Nail texture often becomes less rough. The edge of the nail may look cleaner. Odor, if that was a concern, typically resolves in this window. Continue all 3 steps nightly. Day 15 and beyond. Reduce to 3 to 4 times per week for maintenance. The infection may be visually improving, but the nail still needs to grow out fully. Toenails grow approximately 1.5 millimeters per month, so a complete nail replacement takes 6 to 9 months. Maintenance applications during that growth period help ensure the new nail grows in clean. Photograph your nails on day 1 and on day 14. The change is often more visible in a comparison photograph than it is day to day, because progress is gradual and our eyes adapt to slow change. An elder looked at a tube of toothpaste and saw something the rest of us missed. He didn't see a product. He saw menthol, he saw bicarbonate, he saw eucalyptal. He saw a modern factory accidentally synthesizing what his ancestors made by hand from creek bank plants and fire ash. The knowledge never disappeared. It just changed containers. What you have now is the complete picture, the science behind why these compounds work, the ancestral context that shows how long humans have understood this, and a practical protocol you can apply tonight with things already in your home. If you want the reference list, the original plant names used in Cherokee and Lakota healing traditions, the peer-reviewed studies on the active compounds, and the printable 14-day tracking chart, comment the word remedy below. I'll send the PDF to everyone who asks. And if this connected something for you, if this made you look at your medicine cabinet differently, or your family's old home remedies differently, subscribe and stay close. Because this is one of many places where ancient knowledge and modern chemistry are saying exactly the same thing in different languages. The next one is even more surprising.